Hi, this is Health Focus. My name is Amy, and as usual, this is a platform of everything health under one roof. And when you see me with a guest, it's about to go down in one of the healthcare careers. You are all welcome, enjoy, and share with your colleagues. So who do we have today? As usual, we have pillars in healthcare, and there is a pillar that most of us do not know much about it. When we were growing up in the rural areas, you could go to a hospital, get your small booklet that is cut into half, go home with your notes. Is it still the right practice, or was it the right practice, or is it able to give your care in a very continuous manner so that when you visit again, sometimes we could lose the book? Today, the professional we have is about health information management. He is one of the professionals in healthcare that manages data in one of the tertiary hospitals in Nairobi, and his work cannot go unnoticed. He is a health information management profession. He is a quality management supervisor and auditor. He has a lot. I'll not introduce him more. I'll allow him to introduce himself. Welcome, Ayub.
Thank you so much.
Introduce yourself to the viewers.
I know the introduction is quite loaded. My name is Ayub Balembi. I'm a health information officer, and I have a background in information management. I have a background in health systems management, and I've specialized in health information management.
Okay, thank you so much for that nutshell intro, but we are going to break it down. I like beginning or knowing where it all began until you found yourself in this space. Let's get to know, where was Ayub born and where did he go to school?
Wow, Ayub was born in a village somewhere in Kakamega County.
Mm-hmm.
And he grew up as a village boy walking to school, and for about 8 years, he moved after 8 years to Mumias. Mm-hmm. That was the first time he was having a touch of town life. Mm-hmm. He went through high school, and after that, he thought he would be a pharmacist. And so he applied for pharmacy. And those days, it was very hard to get those chances. Mm-hmm. But then, since I didn't get it, I didn't give up. Mm-hmm. I got advised on taking the health information management way. Mm-hmm. By a brother-in-law, and I was like, will I still get my dream in this line? And she told me this field is wide.
Okay, before we get to the place you've gone to apply for health information, what is the name of your primary school?
My primary school is, and I still have fond memories about it, it was called the Imbale Primary School.
In Kakamega.
In Kakamega County. I went to St. Peter's Mumias High School.
Mm-hmm. So in your high school experience, did you now know what you wanted to be?
Yeah, as we moved towards end of that high school lifestyle, period, mm-hmm. I started developing interest in medicine. Mm-hmm. And the dream was to get the right qualification to get a medical course.
Or medical course. Yes. Did you know the medical courses that we have?
Not really. All you wanted to be is a doctor. Mm-hmm. In fact, thinking of the other professions within medicine was a very remote imagination, mm-hmm. because it's only a doctor who is known in the village.
Sure.
And so everybody would want to be a doctor. Mm-hmm. But least did we know that healthcare has a very wide range of professions, sure. that could still get you to that fulfillment. Now, the idea of pharmacy comes in, when you strive to get to a certain level and you don't get.
Yes.
You now look at what is in your
the
hands.
Nearest landing place.
What do you have in your hands, mm-hmm. that can still get you to that field of medicine? Mm. And so what was in my hands was the grade and the qualification that I had gotten at that field.
Okay. All right.
And I looked at the options available, and I found I can fit
In pharmacy.
in pharmacy. So I applied for it. And as it were,
You didn't get a
chances
chance.
were very hard to come by.
Sure.
I didn't get I waited for the feedback. I couldn't, and I decided, let me look for something else.
Also, you searched and found health information management. How did you know about it?
Initially, it wasn't actually health information management.
Oh, okay.
It was information science
Oh, okay.
as a course that was being offered.
Where?
It was covering records management and records and archives management. It's a broad approach to management of information.
Not necessarily health.
Not necessarily health.
Okay, all
But
right.
still, I was advised that this is still a broad way because information cuts across all fields,
Sure.
and it would still lead you to where your interest is.
Where did you go to have that course?
I joined Kenya Polytechnic.
Okay.
That was in 1993. And I did 3.5 years diploma course. And by 96, I had done with it
Sure.
with a qualification of a diploma in information science.
Sure.
But still, my dream for healthcare had not died off. So I applied. There was a vacancy opening in one of the major health institutions in Kenya, tertiary institution.
Yes.
And they had opened up the scope for recruitment, and I applied.
Okay. That's how you found yourself in the space.
Right.
Wow. At this time when you finished health information management, it's information management science.
Yes.
When you were on continuing with that course, did you ever imagine of dropping and then focusing on the medical career, or you were now okay?
I found contentment at that time.
Yes.
And especially when I finally landed in a medical institution. That brought my dream closer.
Yes.
And that level of satisfaction became much better because I realized I was getting home where I first dreamed to be.
Okay.
And that is one thing I noticed, that there are many routes that can lead you to your dream destination.
There are many. Tell us life about a health information management when you first landed there.
Well, the experience when you first land there, it's a different ballgame. Being in that setup of a clinical setup and having not been exposed to the clinical environment, and especially areas like emergency areas and all that,
Yes.
it takes a lot for you to reformat your mindset and thought and attitude and approach towards service delivery.
Yes.
And you need like a culture change. You
Yes.
have to really have a culture change and get adapted to the medical environment.
So now, what is the importance of even having these medical records kept in the hospital? Because in primary healthcare, you go home with them.
Wow, this is a very important profession. And I think it's a profession that many have not really realized its importance. It's like the bloodline that connects all the other systems. You can do so much, even as a clinician, as a doctor, as a nurse, and any other profession. But at the end of the day, you need that information to tell you how much you've done, to even assess the quality of what you're doing, to be able to measure the standard of care you are providing. So it's a basis of everything that happens. And that's how important I feel this profession is.
So what happens in the hospitals that patients go home with their record?
It is a very unfortunate scenario. Yes, nowadays the constitution and the right to personal information has changed,
Yes.
but I still feel we should have a mechanism of how to manage this information, whereby it can be accessed by other players or stakeholders in the field to be able to, because not everybody has the capability of taking care of their medical records.
Sure.
So if you give someone and they are rained on, that is it.
It is
You
gone.
have no reference.
Wow. The world currently is transitioning to electronic. Where does it leave the profession, especially those who have much of their content on paper?
It's a time people have to wake up and realize that the world is changing, and we all have to move with the trend or the way things are going. And I think I would encourage people in the profession that we have to have a mind change. We have to start looking at the profession in a very different perspective. We stop living in the past where everything should be manual. And in the clinical field, that's the way to go. There are many advantages that come with automation
Yes.
and electronic medical records. And I believe the way the world is going,
Yes.
anybody who is still in the archaic world of manual records will be left behind.
For sure.
It's a matter of time, and the ground will change.
To shift. So what are some of the challenges that health information professional encounter in their work setup?
Well, one is the nature of records. The manual records have a challenge, especially for many facilities have challenges in storage spaces. We have challenges in being able to have better tracking systems to be able to track, especially those facilities that have huge volumes of records. And then the challenge is that portability of that medical information, sharing that information across different professions, playing role in the delivery of healthcare service becomes a challenge. And as a healthcare profession, a health information profession, having electronic medical records that are easily portable, a platform that can easily share that information across different platforms,
providers,
and service providers, it will have a very big transformation in the healthcare sector.
So there's one thing I've never understood, me being part of the player in healthcare, the thing we used to say, do not give the patient the file. And this is my record, this is my history, you've collected all the information from me, but you want to hide it from me. Why is it so, or why was it so before the Constitution?
Well, we have to look at where did it come from, and confidentiality of medical personal information has been there. It's part of the oath that people take in healthcare to ensure that patients' information are well secure and confidential. But then also there's the aspect of how do you ensure that this medical information is secure and properly kept for future reference, for continuous management of the patient, and you don't lose it. Because at the end of the day, if you give this patient this record and it is damaged, not because they want it to be damaged, but it is messed up, they'll come back to you for healthcare. Where do you refer? Where do you start? It is even disadvantaging the patient because it's like starting afresh.
All right. There is another question I keep on asking myself, and I usually don't know who to ask or how to ask it. One tertiary hospital to another, how is it that that institution will start from scratch? Why can't we just share the file across hospitals?
It's a very good question because many times, and that's why we are talking of having an electronic medical record system with a better platform in the nation, which we have a chance to have information portability and shareability, so that I don't need to move with my record from one institution to the other. I only need to give my identification number and one can access the information from the same bandwidth. And I think this will be the best moment in the profession ever when we get it. For now, we operate in silos.
Okay.
Health institutions are operating in silos. You are institution A, the other one is institution B, and each one of them keep their own records for the same patient.
And we take history for this from the same patient afresh.
Right. And it's very expensive for the patient. When you look at it, if I did investigations in institution A
For sure.
and I have to go to institution B, I still repeat the same investigation. Why? Because we are operating in silos, yet we are in the same health sector.
It's a huge challenge.
We are serving the same patient. This can cut down on the burden we put on the patient and out-of-pocket expenses by sharing information. Why should I do an MRI in one institution
And I did
and
it
go repeat it?
1 week later.
Yes.
Nothing has changed.
So I think when you look at it, it's so expensive and costly for the poor patient who can be helped through technology to make their life better.
But somebody will say, and I've heard it, that these institutions' MRI are not adequate. We can't manage this condition. That's why we need to redo it here.
If we standardized healthcare service delivery, if we standardize the way things should be done in healthcare, from a health system management perspective, then it doesn't matter whether I did the MRI in Kakamega County
Nairobi County.
or Nairobi County.
And the doctor is in Nakuru.
The report should be the same, the quality of service should be the same, and it should be able to give the right information. So it's about standardization of these healthcare services, such that wherever I carry out the investigation, it should be credible, reliable, and the doctor seeing me in Nairobi and I'm from Kisumu or whichever county or Turkana should be able to see the same report and be able to use it and trust that report.
For the sake of the patient.
Problem is, I think in the health sector we have had a lot of quacks.
Sure.
And it's very hard for one to trust the other one's report because of that.
The human resource pillar is not strengthened well.
Yes, and I think that's why standardizing services in healthcare becomes a very critical aspect that will levelize the field. And I don't need to worry about what about this MRI that was done in Turkana. It should be the same quality, same report that gives me the same finding.
Okay. There is a platform in the nation that collects all the data concerning conditions in every facility. This platform is meant to enable the government to do planning and everything. Is this a role that is measured in the health information management?
Yes, we have
personnel?
the Kenya Health Information System, the KHIS, and it collects health information data.
Yes.
It's a very, very useful platform. And I think for the Ministry of Health, that was a very good line of thought and direction. And it's about strengthening the systems. It's doing so well. It can be strengthened so that it becomes robust and captures comprehensive information that should be able to help in planning. And as it is, it's doing a lot. It's helping to to plan for healthcare. It's giving a lot of information regarding the morbidity, the mortality,
Yes.
indexes, and I think we have a huge resource in that system.
Is everybody able to access it? Like anybody in the nation, can you log in and be able to see the mortalities of a nation?
Well, I think not. I don't think everybody has access at the moment, but you can still get a lot of info regarding the diseases in the common diseases in the country and common causes of mortality from the internet. You can still access that information, which is originating from the same ministry.
So all the information of data in Kenya concerning the statistics is derived from the KHIS,
Yes.
Kenya Health Information Systems. So does this KHIS get populated by every health facility?
Yes, that is the approach the Ministry of Health took.
Yes.
Such that all health facilities are mandated to report.
There is mandated, there is doing.
They are mandated to report, and they are required by law to report the activities that take place in the facilities, and from primary level
To tertiary.
level. And that is how we have all that information being fed to the ministry system. You'd be surprised that one of the guys I really admire, especially when it comes to getting things done, is the late Wishuki.
Wow.
You know, you focus on the goal and do whatever it takes to get the goal realized.